The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Big topic today. We're talking about new breakthroughs in weight loss. And with us, we have San Diego's probably most sought-after nutritionist. She's an expert on many topics when it comes to health and longevity. Kim Ruby, and she's with University Compounding Pharmacy. Kim?
Thanks for finally having us on your program.
All right. We've tried to get you on here for a while, so good for you. Now, for people that don't know you, you work within the pharmacy. You're the one of two nutritionists.
Yeah.
And your pharmacy.
Our pharmacy, we are one of the most respected, largest compounding pharmacies in the nation. We are AMA recognized. We are board certified. There's only 50 board certified pharmacies nationwide. That's us.
Okay,
yeah.
Okay. Now, you know that I interview doctors, and I like this topic. I'm always trying to figure it out for myself. But when I go to the functional medicine conferences in Miami or Las Vegas or the anti-aging conferences,
we're there.
Everyone knows who you are, too.
Yeah, we are the leaders in physician education. At least a couple thousand physicians a year are touched by our teaching, by our expert speakers, and we pass that knowledge on to physicians and to our patients. We are the best.
You attend those, and I appreciate that, by the way.
We are.
You know, we have to put disclaimers, the best, but you think you're the best, and that's...
We have 17 pharmacists. Okay. 17 pharmacists. We have 85 employees. You can call and get answers from us anytime you want. You can talk to a pharmacist, you can talk to a tech, we'll give you the answers. And we have 2 dedicated pharmacists who you see them every single day, 8 hours a day, educating physicians all day long. That's their job.
I've been on the tour, by the way. Huge place.
Huge.
Big. I've never seen anything like it.
And it's clean, and it is the most advanced technology you've ever seen.
And
10,000 square feet.
So bioidentical hormones. I mean, you're making up thousands, I guess.
That means chemically the exact structure of a woman's body or a man's body.
Now, the weight loss program. You head up that with the other nutritionists.
Yeah, we have another nutritionist and we have a vitamin specialist. We each have been there over 10 years, so we know what we're doing.
Personally, a couple thousand.
I've worked with probably about 2,500 patients.
So the program. Let's talk a little bit about it. A lot of things going on today, by the way.
This is important. It's not yo-yo dieting. It's feeling better for life. It's feeling better, learning better habits for a lifetime. It's aging with grace, and it's having vitality as you age. It's not just, it's getting stronger as you age. When we're stronger, we're more vibrant, we look better, we're more competitive in the workplace. How about that? Look at these times. We are more competitive against the person that's trying to be hired too. We want to be hired.
I don't know what the word for it is, but because I've looked inside your weight loss program.
Okay.
And very sophisticated.
It is. It's fascinating. It's a great weight loss program.
I mean,
accelerated. That's the word
accelerated
that we use.
Weight loss.
Yeah.
Okay, good. Okay. Now take me through the process. Okay. So somebody goes in.
Somebody comes to see us.
Let's start with women. Today's topic, and we'll talk a lot about women today in the menopause. You say it's
70% of our patients that come to see us, they are women. They are women who are educated, they're motivated, they know they don't feel as good as they used to. They know that 25 years ago that they had more energy, that they could wear certain clothes, that they felt good about themselves, but little by little, you know what's happening? They're wearing elastic pants.
I like your story. Tell the story about when somebody, after high school, gained 2 pounds
a
year.
That's 20 years, 40 pounds.
Okay.
It just happens. It's slow. So
one day you look in the mirror and you say, oh my goodness,
what happened? What happened? It's
interesting.
Slow. This is, you know why? We women, we're so busy taking care of other people. We take care of our kids. We take care of our husbands. We take care of our work. Who are we forgetting?
Okay.
We're forgetting us. So this is what happens. You gain weight slowly and slowly and slowly. You forget the good things that you used to do. You're not riding a bike anymore because you don't like how your butt looks or how your hips look. You're not wearing sleeveless tops anymore because your arms, the fat is changing. The fat molecules are actually changing when you go into menopause and premenopause. So the next thing that happens, you get a little bit depressed. Depression sets in. And then your nutrients are off. So you are not taking a multiple vitamin, you're not exercising, you're not taking CoQ10, alpha lipoic acid, you're not taking omega-3 fish oil. You're falling apart, and it happened insidiously, but it's happening. And
so
we
this
look
is
down.
your specialty there. You deal with
we
the
are
people,
good
the
at
tough
this.
ones.
We get results.
Okay, good.
The best patient for us is the one that has said, I've tried everything, and I have patients to show you.
Okay, but one thing before we get into those, and I want to see those, because your structure, to those patients that are completely weight loss resistant, and you just can't figure out what's going on, you can assign them, or I guess refer them to medical doctors.
If you go to our website, we have some of the sharpest, most educated physicians in San Diego who have been through fellowship programs in anti-aging medicine, complementary medicine, prevention.
And those guys are big on nutrition. I mean, when I go to
They're
those...
huge on nutrition, but they will go to our website, www.ucprx.com.
Okay, I'll have it listed
A
at the
whole list
bottom.
of physicians. You'll see them. They're going to give testimonials, but they understand hormones, thyroid, cortisol. They understand the stress hormones.
So even balancing like the neurotransmitters with cravings?
Oh, that's the
That's
worst.
a big topic.
A craving will derail any diet program, weight management program. So we assess that. We have nutritional supplements you can't get anywhere else, only for physicians and nutritionists, that will arrest that whole cascade of cravings that involve the different neurotransmitters, the dopamine, the serotonin, everything like that. And you can be saliva tested, blood tested, and urine tested for those.
But most of your patients, like you say, they come to you first.
They come to us first.
And then only if they're stuck.
Because, you know why they come to us?
Why?
Because their friend has seen such tremendous results. And we have physicians that we have partnered up with, and they're like, we know Beth, we know Kim is going to get the job done. We will teach them to be lean for life.
You say you're changing people's lives.
On a long-term basis, not just for a month or for two. If they want to continue to see us, we are changing their lives for the better. More vitality, they feel better in their own skin. We're unzipping that fat
Tell me
suit.
about what they're eating, by the way.
Oh, on the program that they're on?
Yeah.
Okay, 95% of these patients will choose to do a meal replacement program. Science-based, effective, cost-effective, literally cost-neutral. 5%.
So they get the food from you.
They get the food from us or over our website. Now, the second thing, about 5% say, I don't want to use meal replacements. I want to just do a food program. You tell me what to eat. You structure it. These are my likes. This is my lifestyle. I travel. I just want some foods. And we take into consideration food sensitivities, digestion. Do you know 70% of your immune system is in your digestive tract? Did you know that?
Okay, no.
Well, I'm teaching you.
All right, okay. I want to get on your program after the show.
It's a great program, and I know you like the taste of our products.
Well, you know, you gave me one bag. You said this is a week's worth, and I ate the whole thing. I told you in 2 days.
Yeah, you did, and you didn't even share it.
I know. The gals in the office says, Randy, you didn't even tell us you had the food. But you know what I like when we talked on the phone? That you, at the core level, believe that you have something that's very special there when it comes to weight loss. And the food, you believe, is great tasting. I tried to not let you bring the food here. You said, no, you're going to taste it.
We got to taste it.
So we're going to do that. We're going to take a break, and you're going to show me some of the food.
The food is convenient.
Okay.
It's portable. It tastes great. All you need is hot water, cold water, or microwave. This is the no-brainer weight loss program.
Okay.
This is made for our patients. This is made for the mom, the executive. This is made for somebody who says, give me structure, give me results. That's what we're going to show you.
And if they need the help with a medical doctor.
Oh, absolutely.
So the medical doctors refer patients.
To us.
To you for weight loss.
Yes.
Okay. You know, what is this that somebody hugged one of the pharmacists?
Oh my goodness. I witnessed this. In fact, you can see this probably every month. We had a husband and wife come in.
Okay.
And I witnessed this. The husband gave our pharmacist a huge hug and said, thank you for giving me my wife back.
Really?
It's hard.
Chokes you up a little bit.
Yeah, it chokes you up because these are women that think they're going out of their minds. They have anxiety, they can't sleep. We have a passion for this. And the owners of our pharmacy have made this their life mission. And our pharmacists too. You come in and you talk to our pharmacists, this is just not a job. This is something that they believe in. We love what we do, and we do what we love.
Okay, good for you. Okay, so the program. So they begin the program, they decide whether they're going to eat food on their own, and you tailor it. I mean,
we tailor it to their lifestyle, unique. Every person is very unique. Every person is individualized. But we also assess, like I said, a person's cravings, their neurotransmitters, their nutritional profile, what their lifestyle is. And I will tell you, because their cravings are arrested and they do not have hunger, it's self-motivating. It's a catalyst to keep on the program and to keep the course.
Okay, good. Now, show me these photos because we're just about out of time.
These are exciting. Okay, I'll hurry up. So meet Jody. She's lost over 50 pounds in a very short amount of time.
All right.
She's happier. She feels young again. She can fit into her clothing.
All right,
next patient. Okay, this is Judy. And Judy she's exercising now. She doesn't want to hide anymore. She feels good about herself. She has lost over 50 pounds also in a very short period of time.
Okay, so now are these people that took the food that you gave
Yeah,
them?
these are the structured portion controlled meal replacements.
Was she aligned with the medical doctor?
No, she saw somebody else.
All right.
And she said, "Hi, I want to do what you did," and she came in to see us.
Okay, good.
I would say this is one of my favorite patients. This patient lost over 35 pounds, kept it off for over 4 years. Why is she my favorite patient? She's my mother.
Is that right? Okay.
Yeah, she better keep it off.
She looks good. She looks good.
Okay, this is a gentleman who is in the financial field, and he was feeling sluggish. He had mood swings, and he did not feel like he should. He did not feel young. He didn't feel vibrant. He didn't have any energy. That's what he used to tell us. He tried several programs. He came to us, and we whipped him into shape.
Okay, okay. And how long, I mean, are these people losing 2 pounds a week?
About 2 to 3 pounds a week. Now, he was losing 4 to 5 pounds a week because we put a little bit of exercise program. And because men have greater muscle ratios, their metabolism is a little bit different. They're going to lose a little bit quickly.
Okay, okay, okay.
All right, this is the teacher. This is the teacher who tried every program. This is Betsy. Tried every program. She felt terrible. She felt sluggish. She loved the taste of the products. When she came in to see me, she looked at me and she said, "I'm going to tell you, I've tried everything. I really don't believe this is going to work." Now, we explored adrenal fatigue with this patient. So she's doing great, and she has another 20 pounds to go. So I can't wait to see her.
I don't know really adrenal fatigue and things like that, but it sounds pretty sophisticated. But to identify these things, you're doing blood work?
Blood work, saliva work.
So was she connected with a medical doctor?
Yes.
Okay.
Yes.
Okay.
Yeah.
So
and
she tried everything.
She tried everything, but there was more. That it was deeper. Many of these patients, it's much deeper. It's balancing their hormones. It's looking at the thyroid. It's looking at food intolerances or food allergies.
Okay.
So it's much deeper.
All right.
Okay.
All right.
All right. Next patient. Now what is he holding? He's holding his belt. This is Dave. And Dave now bicycles. He feels better about himself. He feels young.
That's a big difference.
That's a huge difference.
That looks like a gastric bypass.
Absolutely not. No. He's part of a support group that I lead. So he's actually part of a support group in the North County.
Now this is Guy. I mean, when I talk to people, and I've been in and out of great shape my whole life, but a guy like this that's this heavy, he's tried every diet too. What was different? I mean, what do they tell you that's different about your program?
I think it's the structure, accountability, and it works. And you're not hungry.
But what do they tell you? They say because they're not hungry?
You know what? That is one of the major things in a weight loss program. It's hunger and cravings. And we put a stop to that. But also nutritional imbalance. We assess these people. Do they have a deficiency in omega-3s? Their B vitamins, are they down? What is going on with them nutritionally? It's a deeper picture. Goes way beyond.
So it's a big topic.
This is a huge topic, and we know everything.
Now you do seminars. I mean,
we do seminars.
I do. Right?
I do speak at seminars. We are some of the biggest educators nationwide. We do consumer seminars. We do physician seminars.
Now your center, for people just tuning in, well over 2,000 medical doctors, physicians have trained. Have gone to your training programs?
Well, we train about 1,000 a year. So in the last 10 years, it's been about 10,000.
Oh, 10,000.
10,000, yeah. So can you imagine how many patients that results in?
I mean, I know medical doctors that have been on my show that went to your LA seminar not
just
too
recently,
long ago.
Yeah. Doctors are changing.
You guys bring in the big speakers, though.
We do, from the best in the nation. In fact, we are going to offer a free book.
No, you got some freebies.
We
Tell me
got
about
some
that.
freebies. Wait, we have to do our last patient.
Okay, last patient.
Okay, last patient, Stacy G. I took these pictures. She came in to see us. She said, "I calculated the cost of every program out there, and yours is the most reasonable." I thought she was coming in to see us because she liked me and she heard about me. Nope, it was because of the cost. So she's a successful real estate agent, and I'm telling you right now.
That's big weight loss.
Look at her. Look at her face.
Yeah.
Look at her face. That's over 100 pounds. Is her life different every single day from losing 100 pounds?
Yeah, I'm sure
absolutely. She's happier. She's not ashamed anymore. She's a different person, a different attitude. And when people look at her, they see Stacy. They don't see her fat. And that really, really is our main goal. The real you.
Okay, good. So you put it all together.
You know what? It's the piece of the puzzle. Bioidentical.
This is very scientific.
It's science-based.
Because I know we're making it kind of fluffy. They're losing weight. They feel better.
Oh, no. This is true science. And true science is evidence-based, and it works.
Okay, good. We're going to take a quick break.
Okay.
And we'll be at the table next.
Okay, you ready?
Taste this food.
Okay. You're a skeptic. We're going to try it.
And people need to know these are real interviews. So
they are. We're just going to walk over.
If I don't like something...
No, you keep it to yourself.
I'll keep it to myself. I don't like it. We're taking a quick break. We'll be right back.
Hello, my name is Dr. Andrea Cole. This is my office called Center for Age Management in Encinitas, California. My practice centers around anti-aging, creating health as you get older. Part of my practice involves replacing bioidentical hormones. For that, I need to depend on a compounding pharmacy, and the pharmacy that I've worked with for over 10 years now is University Compounding Pharmacy.
My specialty is anti-aging medicine with an emphasis on bioidentical hormones. I've been working with University Compounding Pharmacy for over 15 years. My patients love the quality of their products, they get great results, and they find the logistics of working with the pharmacy to be very easy and seamless in terms of getting refills. I also like working with the nutritional staff at University Compounding Pharmacy because they're very knowledgeable and they're able to come up with individualized solutions for patients' problems to help them lose weight and achieve other results.
Hi, I'm Dr. Ron Rothenberg, and I founded California Healthspan Institute about 12 years ago to provide the state-of-the-art in preventive and regenerative medicine for my patients, the state-of-the-art hormone optimization for my patients. Since the beginning, I've worked with University Compounding Pharmacy. Now, this is much more than just a pharmacy. UCP has created education, and thousands of physicians have attended the seminars to learn this new and challenging field. The pharmacists are partners in my patients' care. They're always accessible and available through an 800 number. I like that. And so, educated physicians, state-of-the-art pharmacy, great pharmacists, it all comes together for the best in preventive medicine. Thanks.
Hi, my name is John Grisella, one of the co-founders of University Compounding Pharmacy. We'd like to take a few minutes and give you a tour of our compounding pharmacy. Please follow me. We have nothing but the highest quality vitamins and nutritional supplements. In addition, we have books on menopause, weight loss, and we have plenty of literature that we make for patients so they can read about the different conditions they have. We have a full weight loss department, and we are staffed by 2 certified nutritionists who spend full-time counseling patients and doing one-on-one consults to help make sure the patient is getting through the weight loss program in an efficient manner. Okay, we are now in our main compounding lab. This lab is different than the way compounding pharmacists used to make drugs years ago. It starts today with a formula. Every formula is checked and formulated by 2 pharmacists working together. We have over 18,000 formulas in our computer right now. Formulas that we don't have that need to be researched, we have a support group of 47 pharmacists throughout the United States and pharmaceutical chemists who assist us into getting the right formula together so that we can make an individual prescription for a patient. And some of the things that we may make for patients would be hormone replacement creams for men and women. We may make transdermal or topical pain relieving drugs for arthritis and sports injuries. We might even make a veterinary product for a cat or a dog or a child who has inability to take a dosage form by mouth because the tablets are too big for them or they don't taste good. There's pretty much anything we can make, and there isn't anything that we haven't been able to make as long as the chemicals are available. And then once the pharmacist gets the actual formula, then he works off this, and this is our assurance and your assurance that we're getting the right product. Everything is, like I said, custom made for the individual patient. This is where we make our topicals and our cosmeceuticals. One of the things that we found is there's a big demand for high quality cosmeceuticals to fight aging and wrinkles and sun damage. When we reviewed the literature, we found all the studies that were done on using vitamin C and retinoic acid and lipoic acid. And we duplicated these formulas so you get a high concentration of active ingredients, and it really does work well. And now we are in our capsule room where all of our prescription drugs that are made in capsule form are made. For instance, we have estrogens over here that we're making. What he has over here is a capsule machine that you can make 300 capsules at a time. And the powder's spread over to the capsule tray into individual holes, and it's unbelievable how accurate this will get. One of the most important things we do as a compounding pharmacy is have our products tested by an independent lab to make sure that you as a patient are getting exactly what it is the doctor prescribed. We're now in the call center and customer service department of University Compounding Pharmacy, which is one of the most important departments of the pharmacy. When we receive a prescription from the physician, either by fax or when they call it into our office, what we do at that point is try to contact the patient to get the information. It's important that we get the correct address, for one, get all their insurance information, because we do try to bill the insurance company. Sometimes they pay, sometimes they don't, but we at least attempt to bill the insurance company for the patient. We are now in the lab that prepares all the creams. As you can see, there's a lot going on here. For instance, right here we're making our cosmeceutical creams, and these are special bases so the patient is not allergic to the creams. It requires a lot of technology and pharmacist involvement in order to get the best possible base so that you can get active ingredients in there without having an allergic reaction. And then over here, as you can see, is some of our techs that are working on some of the different creams that we make also. We make a topical cream, like I said earlier, for treatment of pain and arthritis, where you just apply the cream right to your skin and you get relief instead of taking it by mouth and getting upset stomach. And this is also where we make a lot of our hormone creams. All of the hormone creams, again, they require special types of bases so they carry the drug right through the skin, into the bloodstream, and right to where you need it. So all of this requires high performance technology in order to get the best possible product so the patient gets the desired effect.
Thank you, doctor, for your order, and we'll have you about 2 days. Bye-bye.
This is the Drug Information Center here at University Compounding Pharmacy, and one of the departments that we're the most proud of. We are probably the only compounding pharmacy in the United States that has its own drug information pharmacy that is staffed by 2 full-time pharmacists who are working all day long answering telephone calls for patients and for physicians. Many times physicians who are having difficulty with the patient, or they're new to compounding prescription drugs, they have questions on how to formulate, how to dose, how to administer the drug to the patient. They call our pharmacists here at University Compounding, and we spend the time to work them through their problems so that the patient actually gets the best possible prescription for what their needs.
So we're going to start here. And remember, this is just a jumpstart program, Randy.
Okay.
You will be eating meal replacements until you lose all of your weight. And you'll be eating real delicious food. So you get to make either chicken or turkey or salmon. You can eat out. You got to measure
What
those
are these
portions.
right there?
Those are turkey burgers.
Turkey
and
burgers,
then
okay.
calorie-free barbecue sauce. And look at these packets of dressing.
Now, how could you have calorie-free?
You know, Walden Farms does it. They do it. I don't know. But I
No
also
calorie
know,
barbecue
no calorie,
sauce.
and it tastes delicious.
Okay. How many carbs are in that?
A whole 0.
Really?
0
What about
carbs,
sugar? No
great
sugar
taste,
either.
nothing. It tastes
Calorie.
wonderful.
Okay, okay.
Same with the
I guess they
salad
could put
dressing.
a man on the moon. They could come up with.
They can't.
a 0
It tastes
calorie
great.
barbecue
All
sauce.
of the
Okay.
salad dressing, 0 calories. So you've tasted our little
Yes.
chocolate
So
puff
these are like
balls.
little malt balls.
Yeah,
I
now
call
that's
them
a
malt
meal
balls.
replacement.
Really?
We're using a whey protein here, and we're using just a little bit of soy.
So there's protein in these.
Yeah,
Okay.
It is high protein, adequate protein, we like
Very
to call
good.
it. And then look, we made, now this is not a chocolate tortilla, this is a pancake. Oh, let's just put a little bit of calorie-free
What is it? What is it you're putting on?
syrup, calorie-free syrup. I know you don't believe it, but look at this, everybody. This is delicious. This is my
So
mom's favorite product.
this is a.
This is a pancake. This is a
Well, it
meal
looks like a
replacement.
brownie. It's made out of a brownie looking, but it looks like a brownie.
Brownies is right there.
It looks like a brownie.
It does, but it's wonderful
So
for
it's a
breakfast.
pancake.
So you can have oatmeal, scrambled eggs, anything that's on the program for breakfast.
Calorie-free, sugar-free, carbohydrate-free,
Yeah, it's just not
gluten-free.
free. You have to pay for it.
syrup.
Syrup.
It's good?
It's excellent.
Okay,
Here, just
okay.
dip your
Let me
finger
just
in
dip
there.
it in here.
Okay, what do you think? What do you think?
That's amazing.
That's amazing. So
You
all
weren't
of
kidding.
these are meal replacements. Very important. So we
Okay.
have the soup, night cravings, a meal replacement brownie that you can make in its own little tub. Is that cute in the microwave?
Okay.
We have so many bars to choose from. We have soy nuts. We have, look at this. Oh, best Okay, so that's
what is
soup.
this? What is this?
We have
Soup,
probably
okay.
10 different soups to choose from. Don't dump
When
my
did you
soup.
make these?
Last night, my husband and I made them midnight. Well, wait.
Okay.
Okay, so we carry a very, very hard to find sweetener.
In
It's
the
called
pharmacy,
Slim
okay.
Sweet. It's Lohan. And this sweetener is actually from Asia, and it looks like a little kiwi. 200 times sweeter than sugar. Hard to find, but you can get it at University Compounding Pharmacy. Okay, and so I know you said you were going to do this, the chili.
I didn't want to taste it.
Please.
Okay,
This
so
is
this
the
is the
best
chili.
tasting chili on the market.
And this is meat?
No. This is just protein. This is a very nice soy protein. Don't make a face.
It's really good.
It's excellent. It's excellent. He's smiling.
Well, I see people do this on shows, but
Okay.
it really is that good.
It is good.
But I think this syrup is what's blowing me away the most. I mean, calorie-free, sugar-free.
And remember, when a
Good.
person doesn't have cravings, when their appetite is arrested, it is self-perpetuating, self-motivating. They stay on the program, losing 2 to 3 pounds a week.
So
That's
your weight loss
awesome.
program, they could come in, busy lifestyle, and you just give them the food.
It's portable.
Okay.
Okay. And we have some specials that we're offering.
That's right. You're giving some freebies.
Okay, we have some freebies. First freebie is for a 60-day program, we will
right.
give everybody, they have to mention your show, the
Wellness Hour.
The Wellness Hour. 2 free.
Or Randy Alvarez.
Yeah,
either
Randy.
one, right?
Okay, Randy Wellness. 2 free weeks of food. We're going to give them vitamins for as long as they're on the program, a good multiple vitamin mineral, capsule form. And then look at this. This is the #1 selling new book by Pamela Smith,
Yes.
the leader in hormone replacement therapy reading and author, and this is her, and this is $17.95. If you come into our pharmacy and you mention you or me with a new prescription, you're going to get this. Okay, this is the greatest book. So you will learn what's wrong with
And
people
this is
in your
about
life.
hormones. So you say that the people that go into your program, okay, so they get the food. This is one type of patient. They get the
Okay.
food that they could eat, this medical type food. And for those that are stuck, you hook them up with a medical doctor.
Generally from our website,
Okay.
we have paired up with some of the best
Like the
doctors in San
anti-aging
Diego.
doctors? Okay.
Complementary medicine. We've paired up with them, and they go see
Okay.
these physicians. They get their hormones tested, neurotransmitters, thyroid. They get everything tested, optimizing their hormones if they need it.
Well, that's our program for today. If you can't lose weight, and if you think you've tried everything, my suggestion, I rarely endorse programs. In fact, I never do. But in this particular case, I've met Kim Ruby, I've met some of the patients, and my suggestion is join the over 1,000 people that have lost weight and kept it off. That's this week's program. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.